Hi guys, welcome you back to my channel Exploring MS. I hope you're doing great, and for those who haven't subscribed yet, kindly do go ahead and subscribe to my channel. Thank you in advance. And today I wanted to talk about optic neuritis, what exactly it is, right? So optic neuritis mainly affects your eyes. It is the inflammation of the optic nerve, okay? And majorly what happens is, the symptoms is like, you might lose your vision temporarily or sometimes permanently too. I have gone through optic neuritis myself, and I could not see with my right eye for almost 3 months, but slowly and gradually I regained my eyesight. So how did it happen, right? So again, it is associated with MS, so we really don't know why it happens, right? But it's just that it happens. We really don't know the reason why. But now if it happens, at times it might just get cured by itself in 12 hours, 14 hours, or we might need medication. So the best treatment for optic neuritis is going through the steroid therapy. So in my case, I had taken three bottles of steroid solomedrol, and I had regained my eyesight. That was the first time when I got this optic neuritis attack. So initially the diagnosis, obviously, when I could not see through my right eye, obviously I did not think that it might be because of MS, right? So I went to an ophthalmologist. I showed to the eye doctor, and she did all the treatment, and I could not see at all, with my right eye, and no matter what, they were doing, I was not able to see anything. So, the doctor was very confused as to, what could be the reason. And that is when I told her that, I gave her my medical history. So I told her that, I have MS, so I don't know if that matters. To that, she was a little startled, and she thought that okay, that might be the case. Then I spoke to my neurologist, and that is when he called me to meet him, and that is when I got to know that it was an MS attack. So for those who are suffering from MS, and if you have any issues with your eye, like you might just, your eyes might be paining, or you might have those blurred vision, or you might not be able to see, I would suggest, rather than going and showing to an ophthalmologist, you should first speak to your neurologist, because that definitely can be an MS attack, okay? And if it's treated sooner, the better, right? So then I took 3 bottles of steroid treatment, and then it was like, I never had optic neuritis before, and it was like I could see it very clearly. And that is when my doctor also gave me some oral medication, and that is when I did a mistake of not taking it religiously, so I missed taking my dose, and I got the same attack again, I mean, like within a month. So with first attack, I took 3 bottles of steroid, and I had regained my eyesight, and I stopped taking the oral medication which doctor had prescribed, and it relapsed. I could not see again, with my right eye. So I went and I showed to the doctor, and he said, okay, you have to take the steroid medication again. So I again took 3 bottles of steroid, but my bad luck, this time it didn't work. So the second time, it, even after taking entire 3 bottles of steroid, I could not see, I did not gain my eyesight. So that's when my doctor suggested that I should go through plasmapheresis and all those kind of things. I have in fact shared a video on plasmapheresis, right? So if you haven't watched that video, you can go ahead and watch that video too, where I speak about plasmapheresis. But luckily I did not go through plasmapheresis. I told my doctor that it was very scary for me, and I will not be able to do that. So he told me that okay, since I had already taken the steroid, 3 bottles of it, right? So he would not give it to me again, because in a month I had already taken 6 bottles of steroid. So giving more than that was not suitable. So he put me on oral steroid, and told me that I might get my eyesight back, I might not. So I mean, like, I had to take a risk. But thankfully, with God's grace, I mean, by the end of the 3rd month, I could see, and I got my vision back. So that is what is optic neuritis. It might be a little scary because all of a sudden you just stop seeing, or or you just see blurred vision. I mean, there were times when I could see 2-3 nose of somebody, and the eyes are like, one eye is, and I see 2-3 eyes, and somebody's ears is on top of his head, and so it was very funny, and I was making fun of what I was seeing at that point in time. But I was scared. I was thoroughly scared, with whatever I was going through. And there was very little hope too, right? Because I was going through that pain every day. But luckily, again, with God's grace, I finally gained my eyesight back, right? So anybody who's going through these kind of symptoms of blurred vision, maybe you're seeing 2-3 noses somewhere, you have to be careful. It's not an eye problem, it might be an MS attack. So before you go pure blind, like it's mainly, it affects one eye, right? It will not affect both. So before it affects, you should just see your neurologist and get yourself treated. Usually it gets automatically cured within 12 hours, but if the condition persists, you should definitely go and visit your neurologist, and this is something which can be cured, right, if it is treated early. Like the time you have it, within few days, if you are alert and if you treat yourself, you should be able to fight it back. So that's a short video that I wanted to talk about. Thank you so much for watching, guys. Take care. Bye bye.